Well, just got done with a little walk outside. It was an absolutely gorgeous day. The weather is awesome. A little windy, but felt great just to be outside. I've been working. I've been laid up in the bed again, doing my work. My work computer is sitting right over there right now, getting ready to get back to it. Just finishing up a late cup of coffee as well. About to have some lunch. I've got physical therapy coming at 1 o'clock, which is in 50 minutes, 50 minutes. So I need to get some food, get ready for that as well. Had a weird thing last night. Don't know what happened. I woke up just in excruciating pain. Not as bad as that one night, but I really don't know what happened, but I feel like I must have tried to move. Maybe, I don't know if I just tried to roll over or move my hip in some way where it did not like it, and it hurt a lot. I woke my wife up because I was in so much pain. I was kind of asleep. She got up and didn't know what was going on, and I just tried to calm me down and move me back to my normal position, because it was not good. It felt like I would hold something out of place. I didn't, I don't think, because I went on my walk and felt just fine, but it was just, not a good way to wake up in the middle of the night. We'll just say that. So rest of the day today, day 8 of recovery, is going well. Feels good. I got the ice machine on after my walk and getting ready to edit a video, but I'm getting ready to get back to work. So well, hopefully PT goes well also.
Okay, so my wife had to go back to grad school, so she's going to be at school. Weird pop in the hip. I'm going to be at grad school for from 4 p.m. to 9 p.m. So she's going to be gone all evening. And so it's the first time I'm trying to make dinner for the kids, and it's a little rough, as you can imagine. And so what is for dinner? For Dad's first day cooking dinner, again, now with one leg, basically. Super simple, keeping it very simple. Hot dogs. Kids love hot dogs, don't complain. So I got some plant-based hot dogs getting ready to cook. Got some tater tots in the air fryer as well. So should be happy.
Well, my physical therapy went really well today also. My therapist said that he was impressed. I was doing really well, had good range of motion, lots of strength back in the legs. I was able to pick up my knee laying down to 90 degrees basically, and then push it back down with him putting resistance, which was good. We went for a long walk, the longest I've gone so far, and he cleared me. I could have gone to my daughter's cross country today, which I was super excited about, but then it absolutely rained and poured. I didn't want to try to walk around on wet grass with crutches, and just didn't want to take a chance, unfortunately, so I did not go. But she did great. She got 7th out of, she said, 120 girls, which is awesome. Gosh, my quads look so small. They've lost their strength.
Baby steps.
Doing my physical therapy exercises prescribed by my physical therapist through the Luna app, which is the in-home provider I've been using for my physical therapy. It's been a really good experience. Really like my therapist, Mark. He's been awesome. For a physical therapist, Mark. Well, I just got done with my longest walk yet. Today is day 9, I think. 9. Because today is Wednesday. Yes, day 9 of recovery. And just got done doing a 0.36 of a mile walk, about almost 14 minutes, longest yet, and feeling it in the leg a little bit, some fatigue, so I need to go get on the ice machine. But getting a lot of good motion back in the leg. I'm able to lift my leg up with my leg strength now to get it into the bed or into a chair if I want to elevate it. I don't have to use my hands anymore to pick it up and move my leg, which is really nice. So I'm very stoked about that. It seems to be going well. And I actually am able to walk okay without the crutches. I'm still using the crutches until I talk to my physical therapist and see if that's okay, or if I need to use them a little bit longer still. So anyway, feeling good about day 9. Well, today is Friday, September 20th, which means it is day 11 of recovery, and it's going well, very well. Yesterday, I met with the physical therapist in the house again, and he was very just impressed with my range of motion. I'm able to lift my knee all the way up to 90 with resistance. Him applying resistance, push it down with resistance. I can walk up and down the stairs now without crutches, walk normally as far as both, 1 foot at a time on each stair. I can walk on one crutch, which I'm kind of using right now. I can even walk without crutches, but still want me to use a crutch when I'm going on my walks outside. Yesterday, went for like almost 4/10, like a 0.36 mile walk. And then later in the day, I went for another walk, and I went for a little over a half a mile with one crutch, which was a little too much because I did feel it today, Friday. I felt some soreness in the leg and stiffness, and the physical therapist worked on it this morning. There was a big knot in there, and it's a little painful to the touch. So he said, probably might have gone a little bit too aggressive. So today was to take more of a rest day. So doing some shorter walks and not as much, but movement is good though. It helps, and I'm doing pretty darn good. The only medicine I'm on anymore is the meloxicam, which I take once a day, and then the baby aspirin, which I take twice a day to help prevent blood clots, and then Tylenol. I think that's it. I'm taking Tylenol a couple times a day as the only pain medicine I am taking. I haven't taken any of the Oxy since I think it was Wednesday morning at like 4 a.m. was the last time I took that, I believe, and doing fine. So that's a big plus. But my food is now done. I'm going to eat a snack because I'm very hungry. I'm going to go do some more work. Well, day 13 of recovery. Today is Sunday, September 22nd, and feeling pretty good overall. I just got back from a half-mile walk with my wife. I used both crutches this time. I did a half-mile walk, I want to say it was Thursday of this past week, with one crutch, and that was too much. It was I was in pain after that. So my PT told me to kind of take a rest day on Friday and take it easy on Saturday too. He worked on me on Friday and just kind of worked the muscles and things, and it's definitely tight. I'm doing some PT exercises here and there a couple times a day, but the walking, I'm doing both crutches now for the longer walks instead of one. It's just better right now. Still glad to be able to out doing a half mile. It was cold today. Today's the Pikes Peak Marathon, and they had to alter the course because of snow on the mountain, so it's chilly. Had to put a hoodie on, but it felt good to be outside. And I got the ice pack going right now on the old hip right there, wrapped around. And yeah, just sitting here kind of resting a little bit, and I'll go for another walk later and do some exercises. And yeah, the only medicine I'm on right now is Tylenol, and once a day I'm taking meloxicam still, and then twice a day the baby aspirin for the blood clots, which hopefully I can take these blood clot socks off soon, because they're getting a little dirty to be honest. So yeah, hopefully I can get those off soon. Well, today is 2 weeks, day 14 post-op. So 2 weeks from today I had my surgery, and doing okay. Had my last in-home PT session this morning, and he really focused on some manual therapy and releases, because I start my inpatient or in-office physical therapy tomorrow. I got to go to the office tomorrow for that. See the same physical therapist I saw leading up to the surgery, which would be good. He's really good. And to see what we do. I don't know what kind of stuff we'll be doing. And went for a little walk today with one crutch, which was okay, but definitely felt more fatigue and tiredness in the leg versus using the two crutches. When I was going on my half-mile walks, I was using the two crutches. But today it was just a quarter mile to get my daughter from school and back, and so it wasn't that far and didn't feel that bad. Anyway, just sitting out here with my wife right now, drinking a glass of wine. She's reading some school stuff, and I seem to have gotten some kind of I don't know if it's allergies from the fall or what, but just coughing and a lot of phlegm right now, which is a lot of, when you get a real severe cough, it's not great because that kind of does hurt the hip a little bit. Just that tensing up in the movement, I guess. I don't know. But anyway, hopefully it gets better soon. Well, today is September 25th. It is 15 days post-op. No, 16 days post-op. And not feeling great today. Yesterday, I went to my first in-office PT appointment, and that went fine. And then after that, I was able to take my daughter to her last cross-country meet, which was great to go watch her. She did amazing. She ran her farthest distance yet. I mean, she's only in first grade,
It was 900 meters cross country, on a field, and there was like 90 girls, and she got 5th overall. So I was super excited for her there. But the organization of this cross country has just been abysmal. They're having it in areas where there's no parking, and so we're having to park a half a mile away in neighborhoods and not block someone's driveway, and then walk there, walk back. And that was just a lot for my hip yesterday, trying to walk from parking to get over there. I had quite a bit of pain in my leg, in the side of the leg, which was not fun. And then just trying to walk back after her meet was pretty uncomfortable, as well as a pretty good amount of pain. And I also, as you can tell in my voice, I seem to have got some kind of respiratory thing where I'm just coughing a lot. I'm having a lot of phlegm, a lot of mucus, coughing just throughout the night. And so I'm on kind of like I'm taking like a Mucinex kind of medicine right now, trying to get something to help with the cough and the mucus, so I can breathe and sleep. And because I'm coughing so much that I'm coughing up a little bit of blood, and a little bit of blood coming out my nose as well when I'm blowing my nose at times. That's probably just the dry air, but this could be, I don't know, damage to the mucous membrane from all the coughing I've been doing, a lot of violent coughing. So it's just not been great. And today my hip is a little sore from yesterday, so I'm just taking it easy, not really doing a lot. And kind of wish things were better, to be honest. I did take the bandage off of my leg the other day. I think it was Monday. My in-home PT actually took it off, which was good. And graphic content coming up here, but basically there's another like translucent like steri strip kind of bandage over the incision, but the incision only looks like it was maybe about 5 or 6 inches long underneath of that gray bandage that I showed you before. I guess it was just covering more of the area, but it looks clean. Everything looks good. I've got my 2-week follow-up visit tomorrow with the surgeon, so maybe they'll take that bandage off. I don't know. We'll see what happens there. But as you can see, it looks pretty decent for the major surgery they did. Well, today is September 26th, Thursday, and I just got back from my surgeon's office for my 2-week post-op follow-up, even though I'm really about 2.5 weeks post-op now. And everything is healing well. He said the incision looks great. They took off the little mesh bandage that was still over top of it. Then he put some steri strips over the incision just to make sure everything stays in place. But he said it's healing really well, looks good. Gave me some more stretches to keep doing. Basically, my only limitations right now are I should not be trying to bring my knee to my chest or trying to like twist my foot outward and then taking it back. So don't do that. But keep walking a lot. Walking around the house without crutches is fine, but if I go outside and walk, I should probably have a crutch with me. I did tell him about the cough that I'm having right now, and he did say that it's pretty normal for people to have some coughing issues after a major surgery like this. So he did say that I should get an incentive spirometer, I think is what it's called. Something I can just go to Walmart and pick up, where basically it's a device that I gather I just blow into it, and it helps my lungs, I guess. I'm taking some Mucinex, some benzenate right now, trying to get this phlegm out and the coughing. And he did say that if I'm still coughing in 2 weeks to let him know. Because that could be a sign potentially of like a blood clot in the lungs. They would like to do a chest CT scan at that point. But he did say if at any point I have shortness of breath, for me to go to the ER immediately, because basically that's a sign of a blood clot in the lungs, and they would want me to get a CT scan there and just see what's going on, because that can be pretty serious. So keeping an eye on all of that. Got my PT tomorrow as well, and we'll keep doing those exercises. Trying to get caught up on a little bit of work right now. Then I'll go for a walk later. Hopefully the lungs clear up a little bit, start feeling better. I'm not coughing as much. He did say I could sleep on my side if I wanted to, on my right side, since the operative side was the left side. I would just need to put like a pillow in between my knees
which I have a special pillow for that, so that would be fine. But I'll probably still sleep propped up a little bit, just with the coughing and the phlegm. I think that has been helping a little bit as well. So yeah. All right, so this would be, I guess, day 17 post-op. A little update. Well, we're currently headed to the hospital. Going to go to the ER, just precautionary, hopefully. But I've been having a lot of symptoms that relate to a pulmonary embolism, possibly. Yesterday I had a bit of a fever, and I've been having a lot of like sharp chest pain, like intermittent, like it comes and goes. And I've been having this cough I told you about, but it's been having like blood streaks in it at times. And I've also been having some pain and like stiffness in my left calf as well. So, yesterday I was also a little bit like lightheaded. So those all are symptoms of a pulmonary embolism. So we're just heading to get checked out and make sure everything's hopefully okay. Alright, well, just leaving the hospital. It's just now 12:10 a.m. So we were there for probably 5 hours, just about. It was a long time. But it's a good thing we went in. We did chest x-ray, which they brought in a portable machine into the room, which is nice. They did chest x-ray, they did EKG, a lot of blood draw to check different things, I guess. Then we did an ultrasound of my left leg, and they did find a blood clot in my left leg. So then they sent me for a CT scan of the chest with contrast. They wanted to see the lungs and see how they looked. And they did find a couple of blood clots in the lungs as well. They did say that they were small clots, and they didn't look like they were restricting any blood flow or anything. So basically they prescribed me some Eliquis, which is some kind of medicine that will basically prevent them from growing any. And then over a couple months, they said basically it will allow them to reabsorb back into the bloodstream. So heading home, gonna get I got the first dose of medicine there at the hospital, and I gotta pick up the prescription tomorrow. But they said basically, if it gets worse, if I start coughing up significant amounts of blood, shortness of breath, if I pass out, what else did they say? There was one other thing. Chest pain. If that gets worse, then to go back. And but otherwise, I just got to follow up with my primary care doctor next week. I'll call him tomorrow, but try to get an appointment for next week. And probably have to go see a hematologist. They said do a blood workup and see, because apparently I do have some history in my family on the male side of blood clots. My grandfather and my great-grandfather both died of blood clots in their legs that went to their hearts. I got some, my dad and my uncle are on like a aspirin medicine to thin the blood, I guess. So I'll probably be on something like that. I don't know. We'll see. But super hungry, haven't eaten anything. They didn't want me to eat in case they had to do emergency surgery to go in and take out clots in the lungs. But they weren't big enough for that. So and then get home and eat something. Super hungry. Well, good morning from September 27th. I guess it's, 17 days post-op, 18 days. I don't know. Anyway, I just went and picked up my prescription of Eliquis for, I guess the blood clots, the blood thinners, whatever they are, which is very expensive. Apparently there is not a generic for that medicine. It hasn't been since 2023. So it was $880 for the pills. Luckily, my insurance picked up a large portion of that, but we still have to pay $140, which is absurd for a life-saving medicine. They're going to charge $880 for it. Ridiculous. I did just speak with my doctor's office as well and got an appointment for Monday morning, so I'll follow up with my primary care and talk to them. I think there are a few other medicines out there that are do the same thing as Eliquis that I believe do have some generics. I'll talk to them about that and see if that'll be an option, because I am going to have to get more of this medicine.
I don't want to have to be paying $140 every time I have to buy this stuff. So we'll see. But yeah, I did not sleep a lot last night. I was just coughing a ton in bed and just spitting up phlegm and just not great. So I'm tired and trying to take it easy. Walk though. I'm trying to get up and walk every hour and do some exercises with the calves and the legs. And I've got PT coming up here in a couple hours as well, so I'll probably take it easy there, but we'll see. So anyway, yeah, just a little frustrated and yeah. Oh, what's crazy though is, yesterday, I don't know if I might have mentioned this, but when I saw my surgeon for my follow-up appointment, I told them the exact same symptoms that I was having, and they didn't seem too concerned. Said if I was still coughing and having those symptoms after 2 weeks, to let them know, then they would send me for a CT scan of my chest, which I had last night, but that they didn't see, they weren't too concerned. So really glad that I listened to my body, and I think that's really important as Ultrarunners, or it's cool, is that it kind of teaches us to really be intimately aware of our bodies and know like when something's not right. And I was just sitting on the couch yesterday and walked to the park with my daughter yesterday, my wife, and I was just sitting here on the couch later in the evening, afternoon. I texted my wife because she had to go run some errands, and I told her, I was like, I don't think something's right. I think we need to go to the hospital. And so I'm just glad that I know my body well enough to pick up on those cues and went, because it could have turned out differently.
Well, I'm walking without a crutch right now. I've got the crutch in my hand in case I need it. But we're out at the 24 hours of Palmer race, which Val was supposed to be doing today, but she's been having a little bit of tendonitis issue, so she's not doing that. But we're out here to support her friend, August. Well, I'm just leaving my primary care physician. Today is Monday, September 30th, so 3 weeks from surgery, 21 days from my surgery date. Followed up with the primary care physician regarding the blood clots, the deep vein thrombosis in my leg, and the acute pulmonary embolism in my lungs. And basically he said that they're going to keep me on the medication for a year, just because they think that's necessary. And then after that, they'll take me off the medicine for a short period so that they can do some more labs and check my blood and see, if there's a genetic condition or some sort of underlying condition or disorder causing the blood clots in me, since there is a family history of it. But they can't do that while I'm on the medicine, because it doesn't test well apparently when I'm on the thinners. So anyway, that's the plan. Talked about coming up with my flight I have to go back to Tennessee. They said, with the blood thinners, I should be okay, just to make sure I'm wearing the compression socks at the time. Try to get up and go to the bathroom a couple of times to walk around. But since my flight's only about 2.5 hours, I should be okay. Shouldn't be any concern. So that's the plan. We'll keep moving forward that way. We are going to stay on the Eliquis medicine, but they did send me a link for some coupons, and I did find a $10 copay card as well, so hopefully be able to get that medicine much cheaper now. And then if there's any issues with that, then I'll talk to them about switching it. But I am going to be following up with him in November as well, just to see how things are going. So anyway, that's what's up. As far as the hip goes, 3 weeks post-op, I feel pretty good. I'm walking without the crutches at all now, pretty much. I was able to walk outside for a little while yesterday without crutches. I went to the doctor today without crutches or any crutches, and it's feeling fine. I did my exercises yesterday, my physical therapy exercises, and it felt fine as well after that. A little tight, but not really that big of an issue. So things are going well there. I just need to walk more without the crutches, build up my stamina and strength in the legs still, so that I can get up to at least a mile here in the next month, hopefully more, because I'll have to walk a bit when I'm crewing my wife at the No Business 100. So anyway, yeah, that's the 3 week update and the update on my lungs and everything else. Yeah, it's been a little strange mentally, I'll tell you that, when you have a situation where you, basically could have died. It can be scary. So anyway, stay tuned. This is just weeks 2 through 3. If you haven't seen it, go back and watch the first week post-op as well, a little bit on your screen. We'll have some more videos coming up as I continue my journey through the hip replacement recovery process, and hopefully get back to sport and running. So thank you for watching. Thank you for all the thoughts, the prayers, and support on the first video. I really do appreciate it, and I hope that this is helpful to other athletes and people out there going to be going through a hip replacement. So thank you all. I appreciate it. I'll see you in the next one.